Well, when you ask about what it should look like, the first question I ask is, what's a hospital? Because I think that I believe very strongly that what people's perception of what a hospital is versus where we're going in terms of healthcare delivery is changing dramatically. For example, just think about recent announcements, the interface between entities like CVS and Aetna, for example, the desire for large corporate enterprises like Amazon wanting to move into the health space.
My ideal vision for the future of pharmacy would be spending less time on our manual process and inventory management so that we can focus our time and effort to the optimal care of the patients.
I think a lot more technology than we have today. A lot of pharmacies still use paper for a lot of their processing, and paper is just archaic. We need to get more into computers and other technologies.
So ideally, with all the advances we're making in technology, I think that through enhanced automation and the use of technology, ideally, it would allow pharmacists to shift from more of a distribution, operational, fundamental service type of role, more towards a clinical, cognitive type of direct patient care model, ideally. And I think that within 8 years or so, that'll definitely be more of a reality in some hospitals.
The goal is to prevent admissions to the hospital. So the whole transition of care away from using an acute care setting and prevention, and pharmacy needs to look at new metrics in order to measure our productivity and be able to measure clinically our impact and have avoidable hospital admissions, determine how we partner with physicians and other advanced practice individuals to address the patient needs.
Ideally, we would improve technology so that we can provide the care seamlessly to our patients, be able to have quick inventory turns, provide the care at the bedside with the drugs right there for the patients.
2025, I anticipate a lot of changes, primarily around technology and automation, utilizing less people resources and relying more on technology and automation to increase efficiency, deliver safe patient care, making sure that people are in the right places at the right times, and managing those systems and being very interoperative, things being connected, one network, systems talking to each other, interfacing, and leveraging all types of customers and value-based systems to direct patient care as safely and as efficiently as possible.
In the year 2025, I see pharmacy practice certainly being elevated. In saying the elevation with that practice is really going to require everybody in pharmacy, both the pharmacy technicians and the pharmacists, to be practicing at the top of their certifications and practicing at the top of their license. A big piece that I think is going to help allow that is utilization of automation and technology and training programs to really allow our technicians to take a larger role within the operations and positioning our pharmacists to be more integrated in the patient care delivery and at the bedside.
So one of my biggest visions, and I think that I just spoke on, was that when we build our model, we actually have our technicians and our pharmacists working closer to the bedside, providing better patient care and adding more value to that, and really leveraging automation, analytics, and third-party services to get to that point.
The way I envision is distribution of pharmacy should be utilizing a lot of technology to leverage distribution, kind of get the technicians out of the main pharmacy, get the pharmacists mainly out of the main pharmacy and put them up on the floors to continue with some clinical services, to expand our roles and truly practice at the top of our license, and let the technicians really run the distribution, whether we do tech, whether we use automation or dispensing and things of that sort. So that's where I envision us utilizing a lot of the technology to help supplement, because we need to do the clinical services. We can't just continue to hire FTEs. Obviously, drug costs, healthcare, it's a business that we'll have to run. So how do we really truly expand our services without an abundant increase in FTEs, but optimizing what we have, using technology and going from there?
Now my vision really is not your traditional hospital pharmacy. I think as healthcare changes and shifts, we're going to see more and more space or pharmacists in the ambulatory space, and not necessarily the big box hospital that we are now. So I think that's really the future of hospital pharmacy. It's not going to be in the hospital, but the hospital is going to be at the patient's home.
So I think when we think about the medication use system, we tend to focus so much on the acute care side. Care is very much transitioning to the ambulatory environment, and our issues oftentimes are the same on the inpatient and outpatient side. They just take different flavors. So how am I going to manage a patient when I'll see them for 3 to 4 days on the acute care side, but I'll probably take care of that patient for years to come on the outpatient side? Our practice is a little bit different personally, but different health systems handle it in varying ways across the nation.
For me, it is full traceability. From the time the drug gets ordered by our buyers or whoever's doing our purchasing at that point in time, even if it's automated, full traceability, lot, expiration, down to the vial, down to the tablet, knowing where it came from, where it's been, where it's going, all the way to even beyond getting to the patient. Once it's been administered to the patient, knowing that we're charging correctly for that. How much are we getting paid on the back end of that for that service, for those drugs? And did we do the right thing? Did the patient outcome match what we said it would?
So clearly we're continuing to see evolving technology to support the care of our patients throughout the organization. I mean, not just in the pharmacy. You know, we've got robotics and surgery, but I think within the pharmacy, the connectivity of the various what I call medication use technology systems is going to continue to be critical to enable us to provide safe medication use from the time the medication is ordered up until the time the drug is administered. So some of the systems that are evolving and are kind of becoming connected really enable that. You know, barcoding in my career was such a novel idea, and I think barcoding has a way to go because it doesn't meet all of our needs. There's still a lot of manual processes around that. So I see a much more automated medication use system that will enable us to leverage pharmacists to do more direct patient.
What changes will occur in healthcare delivery and what a hospital looks like today versus what a hospital might look like 10 years from now, I think is there's some game-changing events going on that could dramatically shift the ways in which we both provide care and the construct in which we provide that care, a la a hospital.